Everyone, it is Dr. Elisa Song, and I'm super excited to have with me Dr. Ruchi Patel and Annie from Yobi Care. We're going to talk all about eczema and the allergic march. So I'm going to go ahead and invite them on. This is going to be so needed. We know that at least one in become adults who have eczema. So if you guys have kids with eczema, know kids with eczema, have eczema yourself, then just let us know. Let us know what questions you have. Hi, Dr. Patel. How are you?
Hi. Oh, so nice to be here with you, Elisa.
Yeah, it's so great. I was just saying that this conversation is so needed, and it's one of the conversations that I actually get asked the most about from an integrated pediatric standpoint from parents and also from practitioners, because practitioners want to know. Right now I'm leading a cohort of about 21 pediatric practitioners who are so interested in
Uh,
this integrative approach,
yeah.
and one of the top issues is eczema and the allergic march, and what can we do besides steroids, right? I mean, there's
Yeah.
so much more. So, guys, let us know where you're from, and also for sure, what questions you have regarding eczema,
Yes.
um, allergies. Let me tell you guys about Dr. Ruchi, because there's just so much. I have to say, as I was reading Dr. Ruchi's, she has a book, Food Without Fear, and looking at all of her accomplishments, I was kind of in awe, because really for me, I didn't think that it was possible to do all of this in an academic setting. And here, Dr. Patella is really paving the way for our future, medical students and our residents and our fellows to really understand that there's more than just the no pun intended, but the surface level of treating eczema and even food allergies. So Dr. Gupta, okay, I keep saying Dr. Patel, I don't know why. It's Dr.
Okay.
Sorry, Dr. Ruchi Gupta. Dr. Gupta, she's a professor of pediatrics at Northwestern University and the founding director for the Center for Food Allergy and Asthma
Yep.
Research. So CFAAR, CFAAR, Center for Food Allergy and Asthma Research. I do want to talk about that because food allergies, I'm going to show you guys the food allergy passport. Food allergies, it's an increasingly serious problem for our kids. That really, when I was training in residency, and I think we finished maybe around the same
Thanks.
time, there wasn't this explosion of food allergies that we have now. So okay, so Dr. Gupta, internationally renowned pediatrician and health researcher, um, founder of CFAAR, really paving the way for our understanding of eczema, and so excitingly, founder of Yobi. And I have Yobi right here, the scalp treatment and the skincare. But I
Aw.
do want to talk about Yobi quite a bit too, because Yobi is, um, I'd heard about Yobi from a pediatrician in Southern California, and she was saying, you know what, you might want to look into this, because I mean, it's for eczema. I'm getting some good results with my patients, and it's all about balancing your child's skin microbiome, not just about suppressing the inflammation. So
Right.
we're going to get all into that, because I know kids and adults suffer from eczema. But can you tell us, Ruchi, how did you get into this? I mean, how did you decide to um, really? Well, I have so many questions. How did you get into food allergy and really looking at asthma and eczema, so this whole arena of atopy,
Yes.
and then what propelled you to become not just an educator in an academic setting, but become an entrepreneur and create this whole line called Yobi?
Yeah. Okay. All right. Well, I have to just say before we start, Elisa, I am a fangirl too. I have your
Yay!
book
Look, I'm
sitting
gonna
here,
here. Let's
and
let's hold up both our books.
I love it. It is so brilliant. So, right back at you. You're incredible. And what you are helping people understand is just so important and vital. Just the importance of gut health, microbiome, just all the other pieces, all the R's,
Yes,
that it's just amazing. So, thank you.
thank
So,
you.
yeah, so my story, I'm a pediatrician like you, and I did a research fellowship, got my master's in public health, and then wanted to do research and started with asthma. But so interestingly, oh, you okay?
Sorry, I'm using a
uh,
new tripod. I forgot mine at home. I'm like, I touched the screen to look at the comments. Sorry about that.
that's okay. Um, no, I ended up getting into the space of food allergy because one of my patients, a family who had two young kids, and it was so new. This is 20 years ago. We're going to age ourselves, of course, but I was so curious because there was so little known about it 20 years ago, and so got involved in food allergy. But as fate would have it, my daughter was born, and about 3 years later, and she was born with severe eczema, cradle cap, and then went on to develop a food allergies. And so my son, environmental allergies, some eczema, but hers was a little bit more extreme. So now I'm completely in,
Yeah, yeah,
So that is my early story of food allergy. And then, for the center, we just kept doing more and more research. The prevalence of food allergy, like you said, 8%, 1 in 13 kids. We published all that research. And then we really wanted to improve quality of life, do prevention, which is a really big
yeah.
deal. We can prevent food allergies now, and we have new treatments. So that piece is really exciting. But then now your second question, entrepreneurship. So when my daughter was born, she had that severe eczema and cradle cap. And like you said, as a pediatrician, I was just lathering her with
Yeah.
steroids, her scalp, her skin, and she was just so uncomfortable. So um, being a pediatrician running a lab, I was able to fortunately go in and experiment with different things. And 20 years ago now, or this is 18 years ago now, people didn't understand the microbiome, right? We,
Yeah.
as scientists, were starting to learn more and more about it, and we were on it, but the general public, it wasn't a thing. So back then, we did incorporate probiotics. We worked with dermatologists and allergists here and created Yobi. And Yobi is, probiotics. Um, it is honey, natural prebiotics, honey, turmeric, vitamin B12, like really, really good for you ingredients. And then really after that, being in medicine, I just did what we do. I just gave it to my patients
Yeah.
every day in clinic and anyone who needed it. And then time went by, 5 to 10 years, we kept perfecting it. And that's when actually Northwestern's Innovation Lab came and said, we hear you're putting something out there that's working. So how about, we try to share it with the world? And then we, did 2 clinical studies in kids and in adults. So it works, for all ages. Our goal, just like yours, is we make things too complicated. We need to have one thing that works for babies to elderly, safe,
Yep.
effective, can trust it. And you're not just, messing with your skin and scalp microbiome. You are actually replenishing it and keeping it healthy. So that's the goal of Yobi. So thank you for having
Oh
it
my
right
gosh,
there.
that is,
But
I mean, I have like goosebumps. It's just, it's so exciting. I mean, because really it is true. I mean, now, I mean, you can hardly pick up, I mean, who picks up a paper anymore? But go through your news feed, or
yeah,
scroll through Instagram and hear something about the microbiome. But many people, the gut microbiome is the largest, most well studied microbiome. But
hmm
many people don't realize there's such an intimate connection between the skin
yes,
microbiome and your baby's gut
yes,
microbiome and
yes,
the risks or prevention opportunities for eczema and anaphylactic food allergies and asthma
yes,
and all of that. So it's really exciting. In Yobi, here, let me put it. There's a moisturizing cream and a scalp treatment, right? And the probiome, it's interesting. I was looking at it, it has para
yes,
probiotics. So you're going to have to let us know what para probiotics are. It has organic turmeric, organic honey. Now, honey is so
yes,
interesting too because honey is what I've recommended for patients topically with eczema because
yeah,
especially Manuka honey has activity against
yes,
staph or a bacteria, guys, called staph. So a lot of people
right,
with eczema, kids with eczema, when they scratch and open their skin,
yeah,
they might get a staph infection or impetigo.
Right.
And so honey is just genius there.
Yeah.
And of course, that's going to help support the probiotics. And then there's B12. So I mean, I think it's genius.
Uh,
So tell us what these para probiotics are.
sure. Well, let's just, you educate everyone so well on how important the gut microbiome is and the gut brain connection, right? And so let's just talk about the skin. I mean, your skin is your largest organ system, it's your protective layer of your body, and it is trillions of, um, trillions of bacteria, viruses, your microbiome is all over. And a lot of times, like you said, we are understanding the gut, but we're not understanding the skin. And the skin is so important because the bacteria that live on your skin are very important to maintaining that healthy barrier.
Mhm.
That barrier between your skin and your inside. And what we don't understand completely is that there's so many immune cells that live right below that barrier, and they're communicating all the time. So kind of what you said, it's like your gut, skin, brain, everything is connected and it's all communicating. And so I think a lot of times in medicine, as I know you agree, we separate organ systems, right? Like here, we're talking about just the gut, where now we're skin. This is a skin issue, but it is all interconnected. So now, probiotics we know about for your gut, live bacteria. Paraprobiotics are an interesting thing. So there's post, there's all types of biotics. And what is important is that your skin is able to recognize that bacteria, and it helps fix that microbiome layer. And oftentimes, live bacteria, it's hard to keep them stable.
Yeah.
So what we have are live bacteria that are in there, but are they're bacteria, healthy bacteria, but they're not live, right? So they're intact, stable, but not live. And what that does is it helps your bacteria on your skin still identify it, and they still make the changes, but you're not having to refrigerate this,
Yeah.
and keep it live. So that's really what we're trying to do. And then of course, like you said, the honey, I'm so glad you said that, because the scalp mask that you have there is almost half honey. And it took us a
Mm,
long time to create that so it wasn't too sticky. So when you do use it in your scalp, it rinses out nicely, but it's actually really helping, your scalp microbiome. And the cream, it has quite a bit of honey in it too, but not to that extent, because we wanted it to lather on nicely.
yeah. Well, and I, a couple of things that you said, when we think about the skin as a barrier,
Yes.
we also think about the gut lining as a barrier. And a lot of people who have followed my work and read my book,
Yes.
you guys know that many chronic conditions are associated with leakiness in the
Mm,
gut. But then when we think about the skin as a barrier,
yeah,
if we're not protecting our skin's barrier function, in a way, it's a similar phenomenon where we get this
exactly.
leakiness in the skin, right?
100%. And that's, let's we'll back it up to babies, right? So when your baby is born, like mine was, with terrible eczema, their skin barrier is compromised, right? So these good bacteria, staph epidermis, a lot of others, create this barrier, and then the staph aureus can break through it, and then they itch it, right? You itch and it's red and it's broken. And what happens there is that what we're learning now is allergens can get in through your skin. So, say I'm nursing, I'm eating my healthy nuts,
Yeah,
and nobody knows this 18 years ago, and that protein is falling on her skin and getting through, and then your immune system, your immune cells see it as an invader, right? So, with through your gut, they say allergies stay quiet, right? Through your skin is where it begins. So, what happens is when your skin, now those immune cells notice that as an invader, they go on attack, and it skews your immune system to go down a pathway of allergic conditions.
yeah,
So starting with eczema, environmental, food allergies, and then asthma, they're all related. You don't have to have all of them, of course, but they are related, and you have a higher chance
yeah,
if you have one. So protecting that skin barrier, from the very beginning is so critical. And even when you get older, if you have broken skin barrier, you can still be exposed. That's why a lot of people develop environmental or food allergies at an older age as well.
Yeah. Well, that too, I see so many parents who are like, gosh, I used to be able to eat X, Y, and
Yeah.
Z, and
Yes.
now I
Yeah.
can't. And so, it's so, mm, it's such an interesting thing to think about. How do we tie in the state of your skin microbiome? Because that's going to be your first interface
Yes.
with anything environmentally. And then, of course, through ingestion, that's going to be your second major route of exposure. So,
Right.
let's think about, I'd love to go a couple of different angles. First, let's talk about prevention,
Yes.
right? Because, let's say like you had your daughter, right? And then she had the cradle cap and the eczema and the food allergies. And now you're thinking, oh my gosh, I want to see what I can do to prevent that from happening to my next
Yes.
child. So what are some of the preventive things? Because I feel like, in pediatrics, we talk about preventive care, and to be honest, and no knock on pediatricians, it's hard to do preventive care.
Yes.
I mean, what are we really, when we see this march of, not just eczema, asthma, allergies, but autoimmunity and mental
Uh,
health problems and,
yes.
health concerns. It's like, well, where can we really move the needle on prevention? And
Uh,
this is one area where we actually, I mean, there is data and science. So what would you counsel, a couple who's trying to get pregnant and thinking,
yes.
okay, what can I do either before I get pregnant or while
Yeah.
I'm pregnant,
Yes.
and baby's born?
Yeah. Um, Such a good question. And this is where, at CFAAR, my academic job, we have a lot of great resources for families too, and they're all free and available on our website. But what I would tell a family, that is um, wanting to have a baby is we know so much more now. I mean, we are living in a brand new world than 20 years ago when we started, and we do have the ability to prevent this atopic march. We saw this massive rise, and now we're trying to turn it around. So, what I would tell that mom is enjoy pregnancy. Don't stress out, about all of this. Eat what you want. We have learned that, food allergens in a mother's diet are fine, and they're actually probably good. So trying to avoid certain allergens during pregnancy is not needed, So I don't, it's so stressful already, pregnancy is not an easy thing. And so, um, but when you have that child, what the most important thing is make sure you protect their skin. And, I would love them to use Yobi, but use anything that's natural, that's safe. Make sure their skin is protected. Now, if you start seeing signs of eczema, then you need to see your pediatrician and you need to get that treated, to the best of your ability. That skin barrier, where, like I've said it enough times. But then the next big thing that you need to do, what we're learning more about, and we're here conducting one of the largest studies looking at it, is early food introduction. Another thing, I know you agree with me on this too, is we medicalize so much, right? So we say, only introduce one food at a time and wait 3 to 5 days. Why are we saying that? Babies used to, whatever we
Yep.
were eating, chew it up, get some good mom microbiome, stick it in their mouth, most of the world. So, what I would recommend is, we know we have great data on early peanut introduction. So peanut products, not true peanuts, but peanut butter watered down, and all of this is on our website. But introduce peanuts, eggs, milk in the form of yogurt, which is also very good for your gut, and then some of the other foods. But um, do talk to your pediatrician, because it is very important to get these foods in the diet early. And what we know now is, if you do, you can prevent those food allergies
Yeah.
from happening. So
When you
that
say,
is that is
so Ruchi, when you say early, what do you mean by early?
Great question. So definitely, usually we say around 4 to 6 months. So, when your baby is appropriate, age appropriate to start solids, when they're drooling, when they're sitting up, in a high chair, um, then go ahead and introduce it. Doesn't have to be the first. Introduce whatever you want, like bananas, avocado, whatever food you want to introduce, and then second or third food, start getting into some of these
Yeah.
allergens, especially egg and peanut. That's where we have the most data. But what is recommended now is just feed your baby. Like, let's not medicalize this. And, it's food. And
Yeah.
the more we can get in them in that first year of life, early and often, the more they'll be able to handle, and their immune system won't fight it as an invader. So, got to get it on through that gut, you know?
Yeah. I love it. I love it. I mean, because even, I mean, things have changed so drastically since you and
Yeah.
I were training and really learning about this, what we call anticipatory guidance. And I totally remember the days when, at the 4 month visit, you talk about starting
Yep.
solids at the, by for the next visit. And there was a whole laundry list of no egg whites, no nuts, no strawberries even were sometimes on the list. And,
Oh
and
my goodness.
I remember when my daughter was 6 months old, kind of freaking out because a friend had given her a strawberry. I'm like, no. but but
Exactly.
now we know, as Dr. Gupta said, it's so important, this early introduction and a lot of
Yes.
variety, right? Because aren't some of the studies showing that the more variety
Yes.
you can have in that first 12 to 24 months of life, the lower the risk of food
That's
allergies?
exactly right. Absolutely. Just feed your baby, like it's not and that's what hurts me, because exactly what you said, and that's what happened is the recommendations in the year 2000, AP changed the recommendations to say don't introduce peanuts till age 3, don't introduce egg till age 2, because we did see this rise in food allergies, and it's scary, and we don't want our
Yeah,
babies having reactions. And then what happened was some big studies were done in London, the LEAP study, which showed that actually introducing foods early can prevent those food allergies in high risk infants. And then our guidelines completely
yeah,
switched, and now, so a lot of times, it's we're learning, and until we get that data, we don't necessarily know, but now we know. And
yeah,
so, Maya Angelou, do the best you can till you know better. When you know better, do better. And so
yeah,
now we have good data. It's almost like we need to turn it back around and just feed our babies, let them enjoy that time with your child. Don't think too hard about, all the rules that we put in place.
yeah. And I wonder too, even now, how much this has trickled out into clinical practice, with community pediatricians, because I still think that there is some uh, concern among general pediatricians about introducing all these allergens because it's been so ingrained to
Yes.
avoid them until at least 12 months of age. So guys, just know we want early introduction and variety,
Yes.
variety. I mean, that truly is the spice of life. And also, I would say, of course, for from my standpoint, when I look at the gut microbiome, there also is some good evidence that really supporting your baby's bifidobacter in
Mm-hmm.
their gut.
Yes.
So that means, mamas, make sure you have good bifidobacter, but then breastfeeding with all of those amazing
Yes.
prebiotics called human milk oligosaccharides will support your baby's microbiome. And sometimes, there is one bifido um, infant bifido product on the market that has been, I think there's some good research there
Yeah.
too on supporting allergies. But it's so important to really think about prevention
Yes.
first. And there are some old studies. I mean, this isn't like, as I was starting down this road, I mean, this is in the late 1990s, where, Isa Laurie had looked at giving moms, when there was this allergic history in the family, giving mothers during their third trimester and during nursing lactobacillus rhamnosus
Uh,
GG to
uh,
significantly reduce the risk of atopy. Is there anyone studying probiotic administration to mothers and how that impacts
yeah.
allergy?
Yeah, so luckily the space is exploding, as you know, now that we are familiar with the microbiome. There are a lot of studies in moms. Their pregnancy, I do know a couple investigators who are really interested in that space, but even after birth and the baby, that is really happening fast and furious. Like what are healthy gut microbiota that we need to give them? Things like if you have a C-section, now we have a way to swab your baby
Yeah.
with mom's microbiome, which is really important. So yes, I don't. If you have some favorites, I know a lot of these companies that are working on it, and we are getting really really close. So when we talk about probiotics in babies, I definitely support it, but I don't know if we have locked in on this is it. I think one of the
Well,
things we're learning. Oh, go ahead.
Oh, no,
No,
I
please.
was going to say, I mean, just guys, I mean, I do use microbiome testing for
Yeah.
mom and babies,
Yes.
right?
Yeah.
And I'm chief medical officer for Tiny Health, but we know that babies should have at least, I mean, ideally they
Yes.
have up to 80% or more bifidobacteria. They should not have a lot of diversity in their gut microbiome, which is completely opposite for you and I as
Yes.
adults. We want a lot of diversity. In babies, we don't, because that bifidobacteria really trains that gut immune system connection, and how to tolerate your environment, right?
Yes. Yeah.
Um, so it's just, I think that if there, I would say, another area to look at for prevention is if you have a strong family history of atopy,
Yeah.
looking at your newborn's microbiome, especially if your baby was born by C-section or you're unable to nurse for whatever reason,
Yeah.
so that we can get your baby's microbiome off on the right track is really important.
So true. The study we're doing right now is introducing 8 foods into a baby's diet early, 8 of the allergenic foods. And we are checking their microbiome before
I love
and
it.
throughout the study. And it is so fascinating, like you said, like that gut microbiome and being able to see it and actually relate it to them developing it. Because some kids, no matter what you do, they're going to develop these allergies. So
Yeah.
what is it? And like it's so, people ask, okay, is it just feeding early? No, it's not. It's the skin, it's the gut microbiome, it's all of these things together. So trying to understand what each piece contributes
Yes.
and how to maximize, like you said, like let's fix the gut. Like let's make sure, they have that bifidobacteria. Let's make sure they introduce foods early. Let's make sure they protect their skin, and none of these things are so complex, right? Like those are things that you would naturally do, but we don't always think about, but they all are related and connected. So I
Yeah.
love that you said that. And yes, in the next year we're going to learn so much more because we are monitoring their skin, we're monitoring their gut, we're monitoring their genetics, we've got their blood, and then we're monitoring their diet. So yeah, so hopefully
I
soon. But
love
everything you
it.
said is so spot on. I mean, like I said, I'm a fan. Like I wish I had this when my kids were
Well,
growing up.
I'm like, oh my gosh, the work you're doing is so important, because I mean, we need to get this out, to parents and to
Yeah,
pediatricians, but we also need the
yes,
research. I mean, we need to know what we're doing, and we need to be able to pivot if we find that, hey, maybe like not introducing allergens early on, if that's not the right way, then we need to pivot with that. And so,
yes,
it's I mean, thank you so much. And I also, I do want to highlight something you just said that I think is really important for us, especially us mamas, to
yeah,
know, that sometimes, no matter what we do, our kids are still going to develop eczema and food
yeah,
allergies. And it's not because we did anything wrong, or
right.
we didn't do
Yeah,
enough, or, oh my gosh, could I have done X, Y, and Z? I mean, it's impossible as a mom to not have those
yeah,
thoughts, but really and truly, there's so, I mean, we're looking at all these factors that we currently know contribute to eczema and food allergies, but we're going to find out in 5 years, oh, there are these other factors that we didn't even consider back then. So,
that's so
it's
true.
about just doing the
I mean,
research, right?
I really emphasize what you just said because I think we put so much guilt on ourselves and we try to do everything right. And then when something happens, we're like, oh my gosh, what could we have done?
Yeah.
What did we do wrong? And I really like, I've done that so much to myself. And, I'll tell you, New York Times did it to me because when the LEAP study came out, they interviewed me for it. And I told them about it. And then I told them my daughter has food allergies. And it said Dr. Gupta slapping herself on the wrist for not introducing peanuts to her
Oh,
daughter early. But I take that as an example because, yeah, we didn't know. It wasn't the recommendation. That wasn't what we were doing back
yeah.
then. But, yeah, I wish I would have known. But, kids who do develop these conditions, we can treat them and they live amazing lives. I mean, there's still 8%, 1 in 13 kids have food allergies and they're fabulous. And now we're coming out with treatments for it, so
Yes.
so it is never your fault. Some kids are gonna develop. We do the best we can, but everybody's got something, right? So
Yeah.
and more and more research and more treatment options and prevention, it's all happening. So it's
Yeah.
a great place for these conditions.
So let's talk about I want to talk about the skin barrier and then some of the treatment options for eczema.
Sure.
There are some great questions actually that I wouldn't have even thought of. So,
Uh-oh.
I mean, the first question is protecting the skin barrier. You said that there were two clinical studies already in children,
Yeah,
so I'd love to talk about that
sure.
for not just prevention but also treatment, because this is now we have, let's say we have a kiddo who's really itchy, and for I mean my parents with kids with eczema, it's not even what it looks like, because sometimes it can look so severe and so sad and you're like, oh my gosh, this baby is literally a scab from head to toe. But for parents it's the itching, right?
Yes.
It's the unbearable itching, watching your kids just like, I mean, it's just, it's heartbreaking. And you know, I've seen it in the office where kids are just in this frenzy of itching. And if that's going on, you know, constantly, that's what parents really want, right? And understanding that steroids can have a place in your
Yeah.
protocol. I mean,
Yeah.
steroids are magic.
Yes.
I mean, they squash inflammation, but we can't. I mean, there is something called steroid withdrawal
Yes.
syndrome. I've had kids with adrenal crisis because of their topical steroids. Because you imagine in eczema, your skin barrier
Yep.
is leaky, and you're absorbing everything through your skin. So this one little kiddo was absorbing way too much and just went into, you know, of those steroids, just went into adrenal crisis. And so it's not benign. And as
Yeah.
far as the microbiome goes, I know this, I only know this from the gut research. I'm sure it must be similar in the skin, but you know, there's been some data showing that steroids can cause as much disruption to the microbiome as antibiotics. And so it's
Yeah.
not, it's just like antibiotics. It's not that they're you know, a never. It's just more we need to use them with knowledge
Yeah.
as a part of our toolkit, but then we need to expand our
Yeah.
toolkit. So talk to us about, and you know, about Yobi, the clinical studies,
Yeah.
and also because of the honey. This was one question: can it be used in children under 12 months of age?
Yes. Okay. Perfect. All right. So, the honey, it's a topical treatment like
Mhm.
steroids, right? So it's very thick, the scalp mask, you know. So it's not going to drip, but you rinse it out, and it's just like using any other medication. You just don't try to avoid getting it in their mouth, right? But our honey is, it's not any kind of raw honey, you know. It's organic, pasteurized, heated. So, and as you know, botulism is not like a very common thing, even in general. So yes, you can use it, just don't feed it to
Yeah,
them. So,
yeah. I would say,
um,
I mean, really, as a topical treatment, again, I mean, you're not ingesting the reason why honey is a concern is
mhm,
because really these botulinum toxin spores that can be in some canned honeys. But now, you know, with the way honey is manufactured and, you know, really the production process, as you said, botulism is so exceedingly rare. So I have no concern. And I have had parents but lather on manuka honey on kids' scalps when, you know, when their cradle cap is just out of control. So I have no concerns about that. So thank you for clarifying that.
yeah, yeah. But absolutely. So yes, it does contain a lot of honey, but like you said, it is so healthy, and it does help cradle cap immensely. And that's, you know, how it was created. And then the skin barrier as well. So the skin cream, it's very, very helpful for babies. You can use it yourself. I use the scalp mask every other day. I don't, you know, like, and it's great because you're not cleansing. I mean, you think about how much we just strip our skin constantly with antibacterials or even cleansers, you know, and shampoos, and you can feel the dryness. So when you start using this, the scalp mask is amazing because it really, it does rinse out. You mix it with some water, use it as your shampoo conditioner every, you know, weekend, or I do it every other day. And it just soothes your scalp, and it gives you healthier, you know, hair. It's nurturing. So, but your question about eczema and steroids is really, really important because um, steroids has been the mainstay, right, for so long. But now we have new emerging better treatments. So I would say Yobi is excellent to treat your skin and to treat your scalp. But you know, it is not medicated, right? It's all natural. So if it does start getting out of control, you may need a dose, you know, like steroids, but I would never use it long term. You know, if your eczema is that bad that you're needing repeated steroids, there are other treatments now. One treatment is dupilumab, which is now, it's a biologic, but it is approved down to age 6 months. And it I don't know. I've had quite a few patients who it's really changed their life, and I've had some people who've had steroid resistance start it. Now that's just one option. You know, there are other biologics now for eczema, and there are non-steroidal treatments coming out. But you know, I don't want people to completely be scared of steroids. I think steroids can be an important part of your treatment, but it should never go on. Right? If you use it once, clear the skin and then start using, you know, a good barrier like Yobi. But if you're needing it repeatedly and repeatedly, that's when you need to get in before you start having steroid resistance or adrenal issues. You know, that's just definitely a major negative of steroids. And like with everything, we're more and more research is happening in this space, and we're finding better and better solutions. But what I would recommend is, as infants, you know, start using a cream like Yobi, or like I said, I'm not any protective cream, you know. And then we talk a lot about massage, right? Like
Mm,
massaging babies is amazing, and it does help their skin as well. So there are a lot of things you can do with newborn babies, or even with, you know, us, like oil. You know, massages are awesome. But then use a good cream like Yobi that you trust.
yeah. And you know, I mean, massage it's a part of a baby
Yes.
massage. It's a part
Yes.
of a lot of cultures,
Yes.
right? I was just reading this one. I mean, it's a older uh, article. It was a review of moms who massaged their babies with essential oils, and it wasn't even any particular essential oils. It was just oils that they chose for their babies, and that significantly improved their eczema and their
Yeah.
nighttime, daytime
Yeah.
symptoms.
Yes.
Right? So I
And
mean,
they love it, right? I don't know.
mhm,
I mean, I did it, we did it to both our kids, and it is, they're just so happy, right? You're
yeah,
stimulating them as well.
yeah,
And it's just a great bonding thing between parent and child as well, just to be able to watch them and their joy. And yeah, so many healing things with that.
yeah,
I agree.
yeah. So in terms of the barrier cream,
Yes.
I think the Yobi scalp cream, and I apologize, we've been saying Yobi without spelling it, Yobee. Okay. So Yobi scalp care and skin cream are great, are just a fantastic addition to your skincare routine for your babies, even as you know,
For
as Dr.
yourself.
Gupta was
Yeah.
saying, for yourself, right? And you can use, if you go to yobicare.com, if you use the code DRSONG, so Dr. Song 20, you get 20% off.
Yeah.
So it's so great. I mean, I have a shampoo and a conditioner. I mean,
Yeah.
and I love this. Where is mine? My little scalp
Oh,
massager, right?
that is fabulous. Yes, definitely do that because it helps open up your scalp, and yes, absolutely. Oh, thank you.
Yeah.
No, I
So
love it.
it's pinned in the comments, and I will save this discussion, guys. So if you're joining us a little bit later, you can watch it again. I'll pin it to I'll post it on my Instagram shortly. You know, as soon as we're done. Now there was a question on oh, I know, someone was asking about this probiotic strain that I mentioned for eczema
That-
prevention. That older study, it was with Lactobacillus rhamnosus GG. Now, remember with probiotics, we really want to try to be strain specific because there's actually quite a few different subspecies of Lactobacillus rhamnosus. So the most widely studied actually in children is Lactobacillus rhamnosus GG, which you can really easily find over the counter in Culturelle. So that's a very
yeah,
easy thing to find, right? And then for babies, an infant probiotic, and again, you know, with Tiny Health, we're finding that there are several good probiotics that look like they are able to colonize your infant's gut. I would lean towards a probiotic that is higher in the bifidobacteria species, at least through the first 2 to 3 years of life. And then after about 2.5, 3 years of age, your child's microbiome takes on a more adult-like pattern. So in reality, then the whole family could potentially take the same probiotic.
Right. Oh, wow. Wow. This is great.
So what do you do for, I'm just thinking now for kids who are currently on steroids and it's really hard to get them
Yeah.
off. Where would you start with that? And can you talk about so many questions. So I see kids who come to me with eczema who have never had food allergy testing. What is your recommendation there?
Yes. Oh, okay. So many great questions. All right. So, what I'm excited about, and I saw someone said something about functional medicine. There are a lot of integrative derms now in the world, and I think going to an integrative dermatologist is a great idea. I made Yobi with one of them here in Chicago. Dr. Peter Leo was part of the development of Yobi from
Mm,
the beginning, and he is such a believer, and his whole practice is an integrative derm. And I think integrative derm combines many natural
yes.
treatments along with when you need an actual, medical type grade treatment. So that's what I would recommend. And then food allergy testing is so important. Can I tell you, this really concerns me. And so for pediatricians, it's so important for us to recognize when someone does have a food allergy. In our studies, we found that um, almost 11.5% of parents reported their child having a food allergy, but about 8% really had the right symptoms. So one big important thing is there are a lot of things you can have that relate to food, right?
Yeah.
So it's not always a food allergy, but you want to know what it is. It's so, so important to know, is that, and some of the big ones are milk, right? Is it a lactose intolerance or is it a true IgE mediated milk allergy?
Yeah.
When you talk about wheat, right, or gluten, right? Is it a gluten insensitivity? Is it a true IgE mediated allergy, or do you have celiac, right? Like there's so many different things. So I highly encourage, pediatricians are amazing and we take great histories and kind of try to tease it apart. But then, getting them to the allergist or the GI doctor, depending on what those symptoms are. And not just avoiding the food in your child's
Yeah.
diet. One thing we're noticing is a lot of people will start introducing a food and they'll get a little rash around their mouth, the baby will, and they stop it. And I would say, don't do that
Yeah.
because
Yeah.
they may be sensitized. And then if you stop it completely, what we're noticing is then they may develop that allergy. So if you are worried, get in, with your pediatrician, get in with your allergist and keep those foods in your child's diet. And it just hurts me to see when people actually have to remove all these foods. And then, we deal with it with my daughter, every meal you have to be very, very careful. And
Yeah.
because
Yeah.
IgE mediated food allergies, can be very severe and potentially life threatening. So I'm not sure if I answered
You did.
your
You did,
question.
and I think that's really good because, guys, Dr. Gupta's book "Food Without Fear" really explains the differences between food allergy, food intolerance, food sensitivity. There's lots of different ways we can react, and
Yeah,
in my Healthy Kids, Happy Kids book, when I talk about really resetting your child's gut microbiome, it is important to distinguish. When your child has a food allergy, an IgE mediated food allergy. That is presenting in whatever way it's presenting in your child, we don't want to eliminate that food, and it may stall, it may, the healing of your child's gut microbiome may take a little bit longer, but to Dr. Gupta's point, your child is tolerating it without anaphylaxis in this
yeah,
moment, and so we want to continue that tolerance and not have it become a bigger and bigger anaphylactic type allergy. So if your child is eating, even though we know, okay, this is contributing to their eczema, you don't have to eat a ton of it, but we still want to keep it in their diet.
yes.
Right.
Yeah, and like I said, I mean, get to the right person. It is, your relationship with that doctor is so important. And I know, sometimes it's not ideal. Then you find someone who does, fit you because, like you said, people, different doctors do different things and try different things. But um, food is part of everything we do every single day.
Yeah.
So the more you can better understand your relationship with that food and what it's doing in your body, um, it's so important for you to live, your best life, right?
Yeah.
So,
Yeah.
testing too for food allergies, unfortunately, that we have two main tests, a skin prick test and a specific IgE. And both of those have a very large number of false positives. So really that history, understanding what you ate and what reaction you had, and then the testing alongside it. And then you may need an oral food challenge, which is great, where you just eat the food in your doctor's
Yeah,
office so you're safe. And that is really the best we have, right? And then if you can tolerate it, you just got another food
yeah,
added to your,
yeah.
repertoire.
That
This
is where,
happened.
oh, go
No,
ahead.
I said it happened with my daughter recently with hazelnut, and she'd been avoiding it all her life, and now she's loving her Nutella crepes, and so
That's
it is
great.
it is it is really life changing when you can add a food back in to your
Yeah.
child's or your own diets. So
Yeah, for sure. And in terms of the testing, it is so true. You really do want to make sure whether you're working with an integrative dermatologist, an allergist, an integrative pediatrician,
yes,
when you get these results back, and I've had
yes,
this too, where
uh,
we're doing, an IgE food panel, and um, pretty much everything lights up, right?
yeah,
Low
yes,
level, but it does
yes,
not necessarily mean that your child is allergic to every single one of
right,
those foods. When you look at that, it means, oh yeah, your child has an allergic tendency,
yes,
but they're just in a reactive
yeah,
state. And so, we want to be cautious in interpreting these. And then you have the IgG mediated food sensitivity panels. We
yeah,
don't want to get to a place where we're getting to a more and more restrictive diet, where then we're concerned about nutrition as well, and
yeah,
also just the emotional, the psychological piece of it. um,
yeah,
the key is recognizing that when your child is in this allergic state, let's figure out how to calm the immune
yes,
system down. Let's work on the gut microbiome. Let's work on the immune system. For
yes,
my kids with eczema, it's really important, if they're not, if they can tolerate fish, if that's not one of their allergies, then an omega-3 fatty acid, a fish oil with GLA, so gamma linolenic acid. There's some really good studies on using GLA, the combination, the 369 combination, for kids with eczema, asthma, I mean, even autoimmunity. So that's one of the foundations. We always look at, okay, where are some of the imbalances
yeah,
in the gut microbiome, the skin microbiome, um, and what is this child missing? What do
yeah,
they need more of?
yeah,
So typically they'll need more fatty acids.
yeah,
Get it in their diet too, right? I
yeah,
mean, for sure, you want to, if they can, have nuts and seeds and olive oil and fish and seafood and all
yeah,
of that. And then another nutrient that I find for kids with eczema is often way, way low, and they need a lot of, is zinc, because zinc is so important for skin repair.
yeah,
So it's working with a practitioner who can help assess what your child's nutrient needs are, whether it's zinc, omega-3s, vitamin D is often deficient, sorting out their microbiome, working on their skin microbiome, with Yobi Care, and then really, doing everything you can to reduce other inflammatory sources, which, a lot of
yes,
that's stress, right? So then
yeah,
that's where I love,
exactly.
Dr. Gupta's point. We can't stress about everything. We do what we can,
Yes.
and then we just trust that the body will move back to balance if we give it the right ability.
That's right. That's right. Absolutely. And, think about what are our treatments right now for food allergies. So, when we talk about fear of food, the current treatments we have are introducing the food back in slowly so your immune system gets
Yeah,
used to it, right? So, oral immunotherapy, where you have an allergy to, um, let's do egg, and you do baked egg, and then you get into real egg and small amounts at a time, and you increase it over time. And then your body, a lot of times, develops tolerance to it, right? It understands this is not a threat, this is not an invader, but this is something that you can tolerate. So um, just think through, like, and that's kind of what homeopathy was, right? It's just small amounts. Your
yeah,
immune system is now recognizing it, not all at once, but with the doctor. And then, the other ones are sublingual immunotherapy. Some people, under the tongue,
yeah,
little bits of
yeah.
protein. The other one is, epicutaneous immunotherapy. And now for food allergies, we actually have a biologic that's an anti-IgE. So it protects you from having those, allergic reactions immediately. So this combination is so important in
Yeah.
understanding what it's doing in your system and what's happening in your body, like that recognition and no, don't fight it.
Yeah.
Like is what we've used for so many things. We think of allergy shots,
Yep.
for
Yep.
environmental allergies. So yeah, I think what you do so well is help people just understand those basic mechanisms in our body and what is needed, right, for that full balance and gut, skin, stress, just living your, like I said, high quality, best life you can.
Yeah. Yeah, so important. And I feel like, you know, it's an interesting thing when you find someone that you feel like, oh my gosh, I've been waiting for someone like you, right? Because, it's change in children's health. It needs to come from multiple angles.
Yeah,
And I'm seeing here, comments on, their allergists, said that steroids and tacrolimus could not cause any of the symptoms as she was seeing her babies. Another person saying that their pediatrician said the eczema was not related to allergies. And so it takes the research,
yeah,
that kind of academic backing, and get it into the published literature for that to trickle down into clinical medicine. Unfortunately, what's the saying that it can take 17 years
you're
for
right.
research to translate, but we need that. And I'm so grateful for you spearheading that and being such a pioneer in all of this. And then yes, we need to translate it and get it out to parents, because oftentimes it's parents who are out there. I mean, when you have a sick child, there's nothing a mom
Oh
won't do to research
yeah,
what could you do, right? And so it's often, I mean, it's the moms in my practice who are often the ones who point me to a new, cutting edge therapy, or did you see this paper? Because there's, hundreds, maybe thousands of papers published every week, and you can't comb through
yes.
them all. So I so appreciate that. So it's got to be, from up above with the research, and then on the ground, with parents.
Right. And if, integrative pediatricians like you, are supplying that knowledge, it's so critical, or, us through our research, to get the right information out to families because it's so confusing. I mean,
Yeah.
there's so much going around about so many things and what do you believe and what do you follow, and yeah, and it just adds to that stress level. So,
So
yes.
tell me, I think this is such a great resource. Okay, guys, the Center for Food Allergy
Oh,
and
yeah.
Asthma. So
Yes.
this is, I don't know if you guys are on your phone, you can't scan this, but um, if you go to foodallergypassport.com, tell us what parents will find there and what resources CFAR has for
Oh,
families.
absolutely. So if you go to cfaar.northwestern.edu, it has you'll go to our research center, and what we have is a lot of resources for families, especially around prevention and how to introduce foods to your child. And please feel free to email us, and we'll send you out more specific information on topics that you may be really interested in. If we have it, otherwise we'll try to find it. But we have a lot of information, especially on food allergy and managing it in your child and their quality of life. And this passport is great because the problem with a lot of these conditions is it gets, like I said, very confusing. And that's why we wrote Food Without Fear is, what is it? What's happening in my body? And what happens when I eat a food? And then a lot of the resources on there. This passport really helps a family who has a new diagnosis understand different aspects, including, reactions, what type of reactions their child might have, what to do if a reaction happens, how to use epinephrine, how to talk to their friends and family about it. Because I think one of the hardest things I've seen is that quality of life, because you tell, a grandparent who's never seen this
Yeah.
and they're like, no, it's not real. And you're, and so how do you deal with all the other people in your world who you need to help protect your child or to help support you as an individual? So we need each other, we
Yeah.
need our communities, and And it kind of goes through a lot of those pieces in the mental health and the quality of life because when you're avoiding a food every day and you're scared, it causes a lot of anxiety and
Mhm.
fear in a lot of these kids, you know, and the parents because you're dropping your child off in the care of a school or other people. So a lot of guides around that, a lot of education for the schools, for childcare centers, like every aspect of your life. And then we do have some tools in there around eczema, and then tools around asthma as well. But you know, feel free to reach out to me anytime if there are things you're looking for. I would love to help support as much as possible.
So great. I thank you for creating all of these resources for parents and practitioners. And, one thing to really highlight for families who are dealing with food allergies is the mental health, the emotional, the psychological piece of it, because there is such fear. I remember this one girl who was, she's now, graduated from college and doing amazingly well. But I remember she was in middle school and her friend was eating, I can't even remember what kind of sandwich. She was allergic to, a few different nuts, and was eating it next to her. And she said she told her friend, "Oh my gosh, are you trying to kill me?" And that I'm like, oh, she really was afraid, to sit next to her friend. And so, figuring out how to manage that, air travel can be really, really scary when you're thinking about, all the allergens that can float around in the air
Yeah.
too. So I think having those tools and, really, when you have a plan in mind, it takes a lot of the fear away from it.
Totally.
Um,
And so, you know, we talk a lot about, so we have what we've seen is at least a third to a half of these kids get bullied in some way because I think when you have a food allergy, other kids don't understand that, oh, okay, waving these peanuts in your face, you know, is going to do anything to you because,
yeah,
you know, kids, it's food, right? How can you have an issue with
yeah.
food? So a lot of the videos we've created help educate the kids. And what I've seen is when I go into a classroom and we play the video and we start talking about it, these kids with food allergy are really quiet. They don't want to present themselves. But after the video, they're like all in. They're explaining their situation because then the students are really interested. And I think if we properly educate everyone on what's happening, we can decrease that bullying and we can empower these kids. I mean, I can tell you, we did a study, and for food allergy kids, you know, we talk all about the quality of life and anxiety and fear, but we also asked them what anything positive come out of your food allergy,
Mm,
and the couple things they said is they are better
mm,
advocates for themselves and others, which is an amazing quality you'd want in your child, you know,
yes,
and they have more empathy because, like we said, everybody's got something, and they can feel that in other people, which is again, and you know, top qualities you would want. And then the third is they eat healthier. They actually know what's in their food. You know?
I love
So,
that.
um, so I just want, you know, like our goal is to empower these kids, and we do a lot in order to try to help do that. And there's a lot of cool conferences and support groups that we'd be happy, you know, to help with. And then from the eczema side too, you know, there's a lot of great resources because that impacts quality of life
Yes,
tremendously. Oh
yes,
my gosh, because it's
absolutely.
you're wearing it, you know, you're showing it
Yeah,
like it's right there in front of everyone. And so there are a ton of things we need to do to help support our families who have
yeah.
severe eczema.
Well, and I will say, not only are you sort of, walking the talk with creating these resources at Northwestern and CFAR and Yobi, for families, but I was I got a beautiful care package from your team. And like, what are these kids' books? And I realized,
Oh,
oh my gosh, this is your daughter, right? Your
yes.
your daughter who had all of these food allergies and this eczema, and you've empowered her now. She just graduated high school, right? I
Yeah,
mean,
she's in college. Yep.
right? So you've empowered her to really write books for kids to know how they can um, have a positive mindset around what's going on around their allergies or worries or asthma. So tell me about, how this book series, The Class That Can, how that started.
Yeah.
I think
Oh,
one
of
day we're
course.
gonna have to have Ria on if
Yeah.
she's
But she
if
would
she's
love it.
interested.
I think she's watching right now.
Oh, okay. Well,
So,
Ria, I'm so amazed, impressed, and just I can't wait to really see all the amazing things that you do.
no, it is. This started just like your story about that other child. You know, Ria um, was very nervous in middle school. I think middle school is where it happens. Elementary, there,
Yes.
and then middle school. There's not as many resources a lot of times in middle schools as there are in elementary schools, and that fear, that reality starts setting in, especially if you've had a severe allergic reaction, recently. And it was that feeling of, I don't want to go anywhere where there's like, I remember we were at a party and somebody brought like walnut brownies and she wanted to leave right away, right? Like, so,
Yeah. Yep.
um, and so how do you empower them? And we started, having these discussions about, food allergy doesn't define you, right? It is not, it is just one part of you. And that's why I always say it. Everybody's got something. We're all dealing with something in some way. And we just have to keep that forefront. And that's not what defines us. That's not what makes us who we are. And so how do we get out of it? Because it's meals, 3 meals a day, and kids snack all the
Yep.
time, so it is a big part of their lives. And I have a couple cool comics and this other book that we wrote, but one of them is a kid comes home from school and says, Mom, I met a kid just like me. And the mom says, oh, does she have food allergies? And the kid said, no, she likes soccer. Like, so
Oh, I
so
love that.
it's
Yeah.
it's it's you were a lot more
Yeah.
than
Yep.
this
Yep.
condition of yours. And I think that's where Ria and this other now young adult JJ got together and they started the Land a Can. And the goal of it is to empower kids. I'm trying to remember their slogan. You are what you. Anyway, it's all about being who you are and your strengths, and not being all about your condition. And it's beautiful. So they've done food allergy, asthma. There's a great worry one in there, um, and nutrition is in there. Did I send you nutrition? I hope I did.
Yes, there's
Okay.
food allergies, there's worry, there's nutrition. I mean, I'm loving these, right? The
Yeah,
class that
the
can
nutrition.
nutrition.
Yeah. I hope you approve of that one. But the goal is to have medical experts. So we should do one about the microbiome next.
Yeah.
But it's a nonprofit. It's not, our goal is to get like you do every day. Um, get good information that's vetted by experts out to the public, and this is specific for kids. So it's a nonprofit. So we're trying hard to get it in, to schools and their libraries so they can talk about these
Yeah.
conditions
Yeah.
and and discuss it. But yeah, so that's how that came about, and I'm very proud of them, and I'm proud of the series. And if anyone listening wants a book on a certain topic and wants to be a part of it, we would
So
be
guys,
happy
it's
to.
on Instagram. It's the Land of Can. I love it.
Ah,
We're gonna talk. I'll talk with Ria. We'll set up a
yeah,
call.
that'd be awesome. Yeah, she would love it.
But
Oh,
that is truly, we do all these things as parents and as moms, but it's when we educate and empower our kids. I mean, that's when the real change is going to happen.
yes.
And so, getting into the schools and having this language that we can use with our kids, even from the moment they're born, and we're kind of, doing our little monologue. But we want to use these words that empower and, no matter what's going on with their health.
Yes, 100%. I mean, these kids, they're so resilient, right? And they're just amazing. And I think we just have to help them like become that, believe in it and believe in themselves and support them. And what we find, at least for with eczema and allergies, is the better their support system in their friend group and schools and teachers and parents, encouraging them and supporting them and not like focusing on that condition. I mean, they thrive, and the empathy like they exude is just phenomenal, and that's what we just want to make a more caring world,
Yeah,
right?
absolutely. Well, thank you so much. This was so perfect. I love all of this. I think that I see some
Oh,
comments. I think we have, uh, let's see. So good multivitamin for 8 and 13-year-old. I'm working on it, guys. I have a post coming up on multis because there's a lot of junk out there. I'm sorry to
Mhm.
say, but um, oh, there was one question earlier that I think I did just to quickly touch upon. There's a question on whether, fermented foods or probiotics or both would be better for your gut microbiome. And what's interesting is now this is a study with young adults at Stanford. They make college students make great study subjects. So the researchers took a group of students. One group, they said, go ahead and eat a high fiber diet. Another group was high fermented foods diet. And it was the group with the high fermented foods that had the biggest changes and improvements in their gut microbiome diversity. Now,
Wow.
the fiber group had great changes in their microbiome function. So it's not like you throw fiber out, but it was interesting. Fermented foods are really going to be some of the best ways to get in your beneficial flora. And the thing too with colonizing your gut, it's really important. What I talk about in the book is it's not just about throwing hundreds of trillions of probiotic strains into your gut. It's not, I mean, in the book I say it's not like Jack's Magic Beanstalks. You can't just throw them in there and expect them to grow, this beautiful colony of microbes. We need to nourish them, right? So that means we need the fiber, we need the variety of fruits, vegetables, legumes, nuts and seeds, whole grains, whatever we can in our diet to make sure that we're feeding all the good guys. I mean, that's the most important thing. So you can, try different probiotic supplement blends, but even more than that, and that is a part of, like I said, that is one of the tools I use as I'm helping support kids gut microbiomes. But it's not a long lasting tool. Once you have a healthy gut microbiome, then you really want to use food as medicine.
Yes. Wow. That's great. I love it.
So any last closing, I mean, we could go on and on and on. We're
Yes.
definitely gonna do this again, but any like closing words for the parents who are listening?
Wow. I mean, I'm grateful for you listening for this long, and I would just say, like, just take care of your skin, take care of your gut, take care of yourselves, and your children. And it is so so important to know that you're never doing anything wrong. Everyone's doing the best they can, and we are all here to help support you. And that is our goal. And you're doing a great job.
Yes,
So,
yes.
your positive reinforcement of the day. Yeah. No, thank you so much.
Oh,
And
thank you.
thank you, Elisa. I mean, you are a force of nature, and really spreading such good information to the world. I learned a lot from you, and I look forward to learning more
Yeah,
and
I
staying
yeah, this is
close.
definitely good. This is the start of a beautiful, beautiful
Yes,
connection. So I love it.
me
Um,
too.
the last, I'm just gonna wanted to plant this seed because I saw it a couple of times to do a show on allergy and associates of lacrosse. So I do have that information written down. I'll pass it on to Dr. Gupta. Okay, guys. And then would you recommend using Yobi products prophylactically for infants? Absolutely. That's
Absolutely.
absolutely, yeah. When we were speaking about protecting
Yes.
the skin microbiome and barrier for your babies from the moment they're born, 100%. The scalp treatment and the skin cream are amazing, from birth, right?
Yeah.
So you can absolutely use that. And then yes, Tiny Health is the test that I use for gut microbiome testing because it is the only test that has well, first of all, it uses shotgun metagenomics, which is the gold standard, not beyond PCR. So we need to really look at the entire microbiome, not just what we're amplifying with PCR. And then Tiny Health is such a wide database of age ranges. They really have microbiome specific markers for age ranges based on even 0 to 3 months, 0 to 6 months, 6 to 12 months, there's shifts. So even within that infant toddler stage, there's shifting. And then there's a different microbiome pattern that we see in our 5 to 9 year olds, which is different than our teenagers, which is different than our adults. So it's a fantastic test, and that is we don't want little kids and babies microbiomes are not little adult microbiomes.
Yes.
We cannot interpret and analyze them the same way, and so it really relies on using infant and toddler and pediatric specific norms to understand, where we can really intervene.
Wow. Huh. Okay, we're gonna have to collaborate on some of this. I
Yes,
would
yeah.
love.
All right, guys, we will see you guys soon. This video will be posted shortly. And for sure, if you have more questions for Dr. Gupta, then let us know, and we will be back on together. So,
Great.
all right, talk to you guys
Thank
soon.
you.
Bye.
Bye.